Hello, welcome back to Learning from a Layman. I'm Carl Christensen. I'm joined today by most of our crew. We've got Cameron, Tim, and Johnny all together for the first time in quite a while. So, well, okay, we're missing Matt. But Matt will be joining us again, hopefully in a podcast soon, so that we can continue our history series. But tonight we're going to be discussing attention deficit hyperactive disorder, or and a number of related things. So, as you can imagine, Johnny's going to be insightful as far as the doctor side of things. Johnny's going to tell us about some of the medical treatments and how that's diagnosed and dealt with. Cameron's got insight because, Cameron, you dealt with this, or deal with this still. Right. And Tim has the exposure to this that I think a lot of people have seen and experienced, and that's the inside the classroom. And so Tim's going to give us some insight on what strategies they employ in the public schools to deal with ADHD and how to help people with that are struggling, kids that are struggling with that. So let's dive in with a little bit of a definition first, Johnny. Is there a difference between ADD and ADHD?
Yeah, so most people call it ADHD, which has the hyperactivity within the title. And you can actually have two different types of ADHD. You can have hyperactive and impulsive type, but you can also have inattentive type. So it doesn't quite. I think ADD is probably more accurate, but everybody says ADHD. So you're not wrong by saying ADHD, even if it is inattentive type.
Okay, but when you diagnose Johnny, I guess that's the next question I was going to ask you, is if you diagnose it, is that something that a pediatric doctor does, or is that at a psychiatrist, or who does the diagnosing?
Yeah, generally the diagnosis is done by, if it's in childhood, by a pediatrician. It's pretty prevalent, I think I read somewhere that it's upwards of 7% of the population have ADD. So it's something that as pediatricians we see in the office all the time. And there's different scales and things like that that we can use to make a diagnosis. And there are certain criteria that someone has to meet in order to be diagnosed with ADD. We generally don't refer to psychiatry unless the standard therapies are not working or the medications get so complicated and they have comorbid, like depression, anxiety, things like that are also being treated with medication, where there can be a lot of interactions with those medications. Those types of cases would go to the psychiatry team. But for the general kid that can't sit in his seat and has ADD, he'd just come to the regular clinic with us.
Okay. And Cameron, it's been obviously a long time since you were diagnosed with ADD. Do you remember what that experience was like, and what prompted the move to get diagnosed?
I don't know exactly what prompted the move. That would probably be a better question for my parents. But I do remember that I actually went to a childhood psychologist to get the diagnosis, which has probably evolved over the years now that pediatricians do it. It was still relatively new when I was diagnosed. Not new, but newer when I was diagnosed.
Don't date yourself, Cameron. You're young. You're young at heart.
I think it's become more recognized as we get now than before. So yeah.
Right. Okay. And now, Tim, before the podcast, we were talking briefly about classroom management, and we're going to touch on a lot more of this in depth here in a minute, but I kind of wanted to get a quick overview of what the experiences are across the board here. Tim, you've taught high school and junior high. I don't think you've taught in elementary school, but
No.
But by the time that you've seen kids, what is the, do kids have a handle on this, and how does public schools deal with kids that have been diagnosed, or maybe even that haven't been diagnosed, but that there is some indication that there are problems?
So yeah, by the time the students get to secondary schools, for the most part, people, diagnoses have been in place for a while. Usually, if a kid's going to be dealing with ADD or ADHD, they'll, they're aware of it by sixth grade, and so when we see them, usually we'll get notifications at the beginning of the year. We call it an individualized educational plan, an IEP, and it's basically the school's effort to take care of kids and help them, planning with parents and with the kids, with counselors and other, stakeholders to, try to help the kids be successful and learn how to work with whatever challenges they have. So we'll get those notifications on our rosters at the beginning of the year. And a lot of times, especially early in the year, we'll have meetings with parents and counselors and students, all those people, to talk about the plans. And there's a whole menu of interventions, we call them that, that teachers and students can use to, obviously schools are not well suited for students with ADD or ADHD. And so we have to find ways to help them cope and ways for us to cope, because it can be a challenge to have kids who are, maybe distracted or acting in disruptive ways in the class. So we'll use things like, moving a child closer to the front, making a plan for movement, a child can get up and move around. Other plans for things like testing, if the child can take a test in a different environment, or even other interventions like have a test read to them, have extended time to accomplish a task, and basically things where, looking at it as an educator, you want to stay pragmatic, and sometimes people tend to look at someone who's struggling or who is acting out and kind of clamp down and say, stop doing that, well, and if they don't, then, well, you're going to fail. But we recognize that if you just leave it like that, kids are just going to fail. They're going to have a terrible experience and nothing good's going to happen from it. So, we try to set up a scenario where they can be successful and work towards their own success. And usually kids are able to do that, and they're not always going to flourish necessarily in a school environment, but they can get along, and some do flourish, of course. So
now, do you? I guess you're a teacher, not an administrator, but so kids that have come to the secondary school level, like you said, they've generally been diagnosed already. Is this something that goes into consideration when, like, if you have multiple kids in your class that have ADD or other learning disorders or difficulties or whatever, I'd imagine that would be very challenging. Did principals try to make it so that you're not overloaded? Because we're going to talk about this a little bit more later, but the number of kids that have this is significant, and I'd imagine having, let's say, 10 in a class would at some point become intractable, right? Is that something that you've ever heard of?
Oh, well, these are questions that are constantly on the minds of teachers, administrators. Yes. It is a matter of, it depends. Johnny talked about kind of, different, like, I don't know what the word would be, but different versions of, ADD or ADHD. There, a lot of, so what you're talking about with the challenge of having lots of kids in class would be kind of students who have or experience it in a disruptive way, right? Not all do. I've had kids with, a diagnosis like that they're, they may have trouble focusing, but they're not acting out or being disruptive. So those kids, you have to work with them where they're at. But as far as managing a classroom, that's not much of a difficulty. And then you've got, of course, kids who do. I would say, of course, if we were to collect all of my most disruptive students, I don't doubt that there would be a higher incidence of ADD or ADHD among those students, since that can often lead to disruptive behaviors. So we don't just say, well, here's all our ADHD kids, we got to spread them out. Usually we have some experience with these kids already, and so we can kind of look at that and say, all right, these kids here are quite disruptive, whether or not they have ADHD or ADD. And so, yeah, the registrar and the counselors are usually involved in this, and sometimes the administrator, and they will sometimes have to say, okay, we need to keep these two kids apart because they really go off of each other. But that said, there's lots of other factors as well, electives that kids are choosing to take, what track of, are they on an advanced math track, for example, then or are they on a remedial math or English or something that may limit, where they're placed. So you do have some variation. I'll have some classes that are much quieter and some that are much louder. You also have other factors as well. Usually classes towards the end of the day tend to be a bit more difficult, especially the last class of the day. I think in part because kids are just done, but also sometimes you have medications that are wearing off. So kids that are, much easier to work with early in the day might become more difficult. My most difficult class right now is definitely my last class of the day. So it's just, one of those things you try to manage the best you can. That particular class, when I make my seating chart, I just seat certain kids first, and I just kind of scatter them around the room, just all as far apart from each other as I can. And it, with
how effective is that, Tim?
Yeah.
I would also like to point, I think some of the teachers are done by the end of the day as well.
Very true.
That's not
very
possible.
If teachers ever act like they're students.
How many teachers have ADD? Huh?
Yeah, that's right. If you sit in a teacher training, you'll be like, this seems an awful lot like a junior high school class. Teachers in the back, acting up and ignoring the instructions of the instructors. Yeah.
Awesome.
So
Tim's in the front row with his blinders on, just trying to stay focused, taking notes with his
that's right.
right
Well,
hand.
I want an A.
Not left-handed. Just
Hey, that may be true, but not
Tim is
true.
a hand trader. I don't know if that's come up in the podcast in the past, but Tim is an imposter and a charlatan. So
And you guys are just trapped in this black and white world of one hand or the other. I enjoy both of my hands and use them for all sorts of tasks.
Oh.
We should do a podcast episode on that. Handedness.
There might be eventually a handedness episode of our podcast, but we're distracting, which is appropriate in an ADD podcast. But we're gonna move. Okay, we've talked a lot about class here. I know a lot of people are probably interested in kind of the neuroscience behind it, or how the drug, the medication works and that kind of stuff. But before we get to that, I wanted to, Cameron, we were talking about class and school and things like that. Cameron obviously had to deal with it as a student. Cameron, what worked for you in school as far as classes go, and dealing with ADD, and what didn't?
Well, through a large portion of school, I was unique in my choices of how I dealt with certain things. I would take, I went on and off Ritalin and through most of my schooling because Adderall hadn't been out yet. When I did later have Adderall in college, but definitely some of the things that Tim said were allotted to me with my IEP, individual education plan. I believe that's what it is, right, Tim?
Yeah.
Okay. I had time and a half on my tests. I always felt like, I don't know, less of a student because I had it. I don't know. That was just me, like, very self-conscious about certain things. But anyway, I would go to a testing center in the school, pull out, and that significantly helped because I was isolated kind of by myself, and that helped me focus a little bit better. I would still, obviously, just with my tics that I had, would get off, like, drumming my fingers, having to move a lot, little fidgets. I tried to be pretty good about it throughout most of the time, but The teachers just knew, like, he just fidgets all the time. Like,
right.
It sucks for even interviews that I've done. Like, if I'm at a desk, I hold my hands under my desk and I just play with my fingers and then try to just, it's
right. Yeah. So that's the movement from childhood dealing with the class, moving on to an adult life where you have to deal with it in a job or interviews and stuff like that. So we can certainly revisit that later. I do think it's important what you said, as far as, like, I think probably a lot of, and Tim kind of indicated this as well, probably a lot of kids with ADD feel like they are told frequently that there's something wrong with them, and or that they have that they're just, they're a distraction, and they're all kinds of, I don't know, just things that would probably make kids self-conscious and worry about their ability to achieve any type of success, either in class or later in life. So I think it's important to recognize ADD, be able to support it in the right way, and have a good support system for the kids that experience it up and through adulthood, even adults that deal with it, and how to deal with it. So
let me sound off on that real quick. Oh, Cameron, good.
I was going to say, I did notice a difference between when I had a block schedule versus 8 periods or 6 periods a day, whatever it was. The transitioning between different things kind of helped a little bit, because you kind of get that movement, and that kind of helped refocus. But sometimes it also is harder, because then you have to train your brain to reignite at the new, I don't know, refocus in your new classroom, and sometimes that's difficult. Like, I don't know, sometimes it takes me a good 15 minutes to kind of focus my head to being able to pay attention. Sometimes it just kind of depends what it is. Depending on how much you like a subject, I think sometimes also affects how your ADD happens. If you are less interested in a subject, it definitely is harder to focus it for me. Because everyone's different, but for me, I would say.
Sure.
But I think that's a common thing anyway. If you don't like a subject, it's harder to focus. But I think it's a little
experienced
extra.
more acutely by those that generally have a harder time focusing anyway.
Yes, it's very much like there was classes I definitely struggled in more, and
sure.
I feel bad for the teachers, but I had really good teachers throughout school that are always there helping me out. And the other thing was, I have to give a shout out to my parents, because they would patiently work with me and help me focus so I could get my homework done. So
right.
Those you gotta learn your child, I would say.
Yeah. So, yeah. Got to put the time in.
Yeah.
Tim, you had something you wanted to say?
Yeah, and I'm gonna walk a line here.
We can't see you anyway, Tim. It's okay.
That's right. Cameron was mentioning that that how someone feels when they have ADHD or ADD in a classroom, and I don't want to say that, if you have ADD or ADHD, then you've got nothing to work on, right? I think we all have things to work on, and we have to work through our challenges. But if any of you listening deal with ADHD or ADD, or you have a kid or friend who does, and if you ever felt down about that, I hope that you'll recognize, and this is coming from me as a teacher and as an invested worker in the school system. The school system is not perfect, and it is not well suited. It's not a good environment for a kid with ADD or ADHD, and we need to keep that in mind when we're dealing with this. So if a kid's really struggling, if you're really struggling in school, that doesn't mean that you can just quit or write off, say, well, I have ADD, so that's why, so I'm just going to give up because it's not my fault. You don't do that, but you don't give up and give up on yourself, because you recognize that the school system is not life. It's not the world. It has flaws and weaknesses, and one of its flaws is the this stasis inherent in having to park a lot of kids at one spot for an extended period of time, which is not quite reflective of how the rest of the world works. So kids with ADD and ADHD, I fear, going through the school system, get that implicit, repeated message that I'm inferior, I'm not good at things, I'm destined for failure, because they don't match up well with the school system. And then you see after graduation, a lot of those problems kind of melt away. And as Cameron has noted with his experiences, it's not like the problems go away or the challenges aren't there anymore. But one, you learn how to deal with it for the goals that you want to accomplish. And two, the world isn't a classroom, and you're not stuck in a seat for 60 hours or 60 minutes or 90 minutes at a time all the time. So anyways, take heart and be patient with yourself. Use school as a chance to polish yourself and learn how to deal with some of those weaknesses, but recognize that school is not the world. I think all of our kids need to have that in mind.
Do you put your students in seats for 60 hours? That seems excessive.
Well, I tried once, but there was a big dust up and a lot of angry people. I don't know. After 14 hours, it just fell apart.
Okay. All right. Good.
Hey, Tim, just out of curiosity, I believe your youngest sibling has ADD. Would you say her experience going through international school would be, do you think it was a more positive experience in an international school versus a mainstream American school?
That is a good question. I will have to ask her. I'm curious what she would say about that. My guess would be yes, for a couple of reasons. One, I toured the international school that she attended, and it was if you're a public school teacher, the last thing you want to do is tour a very nice international school, because they capped their class sizes at 18, which was less than half of my largest class.
There's pure juice coming from the drinking fountain.
Yeah, that's right. Well, and you've
That's
got
Hawaiian
these.
punch.
It was delicious. And so you got these just more resources all around. Each class had an aide that would help the teacher. You tend to have a different demographic in an international private school. Kids who don't deal with as many struggles in their of various sorts, and so you've got easier things in various ways. I don't doubt that my sister benefited from that and from having teachers who were able to focus and give more attention. That said, resources and those kinds of things aren't everything, and I know the school was still a challenge for her in some ways. So that's a good question, and I have never asked her about it, so I think I will.
Okay.
But,
well, there you go.
But yeah, generally speaking, the more strapped a school or student or teachers are for resources, the worse the experience is going to be. I felt absolutely terrible when I had a class of 40 and a class of 38 and some very difficult kids to work with, and I just it was a challenge just to keep everyone seated in the room, let alone deliver instruction and work with kids and all their different needs. When you got 40 kids in a classroom, it's just not the same as when you got 18. So that's definitely a factor, I think. There's all sorts of classroom dynamics there. So I think that's probably the answer is you need to be rich and send your kids to a private school, live abroad maybe, and all your problems will be over.
That solves it for the layman. You've solved it.
That's right.
Okay, so before we move, so we've talked, like I said, a lot about school and how to deal with it at school levels, which has been great. Before we move on, like I said, I think a lot of people are interested in kind of the doctor aspect of it. So Johnny's going to give us some insight into diagnosis and medication and behavior as far as what can be dealt with at a clinical level. But before we do that, as I frequently do, I'm going to take us on a quick tour of our users. I always say users. the software guy in me. Our listeners, we are joined by a lot of people right now. I've mentioned before, I'm in California, and I rarely mention the listeners we have in California, but California is really going strong. We have a lot of listeners in California, so appreciate everyone that tunes in here and tunes
It's
in.
all of your children, Carl.
It's just my wife. The five make me feel good about myself. She's downloading it hundreds of times. No, but one place that I don't believe I've brought up in a podcast in the past, which I think is really awesome. We have listeners in Tasmania, and as a layman, as an American layman, Tasmania, I don't know anything about Tasmania except what I learned from Looney Tunes.
I was like, you don't know it's just a small island off the coast of...
Okay, well, I've seen it on a map, all right? And I've got some friends from Australia, but no one from Tasmania. And, the Tasmanian Devil on Looney Tunes, I've seen the Tasmanian Devil in real life as well. I live close to San Diego. I've been to the zoo there. They have Tasmanian Devil. It doesn't exactly look like it did in Looney Tunes. Additionally, the little whirlwind thingy I've never seen that. I don't even think that's real.
That's really disappointing. I'm not going to lie.
But I do appreciate people tuning in from all around the world, the UK, India, I said pretty much every country. So that's great. We appreciate it. But now we're going to talk more about diagnosis, Johnny. So we talked at the beginning of the podcast about how diagnosis is done usually by a pediatrician. What is it? The parent brings in the child hoping for that diagnosis, or is it something that you'd see in a normal exam that you'd say, hey, this looks like you might be dealing with ADD? What's that process look like?
Yeah, so there's two different types of parents. There's the ones that hope that their child has something terribly wrong with them. And there's the parents that don't think anything's wrong with their child. And then there's the ones that are in between. And most people are more in between. But I would say most people come in when they are, most parents will make an appointment when they're suspecting that something is wrong, or when a teacher points out that the child may have ADHD. I would say those are the main two things. So they'll usually set up an appointment for concerns for ADHD. So you already kind of know what you're getting into when you go in there. But during our well child visits, when you go see the doctor every year, when you're younger, it's like really all the time because you're getting all your vaccines and make sure you're growing and stuff. But once you get older, it's about once a year. We always screen for developmental things. And a lot of times people with ADHD will have comorbid conditions. That means they have things in addition to ADHD, like some type of delay, like maybe their language is delayed or they're not doing well in school. And so they are suspected to have some type of learning disability. And that should clue you in that there may be something going on. For me, when I have a child in the office, it's pretty obvious when they make that appointment, the ones that do have the hyperactive type of ADHD. They're bouncing off the walls. They can't sit still. They're taking my stethoscope. They're listening to mom. They're interrupting. They're very loud. They're all over the place in the room. And you're like, well, we don't even need to fill out these forms. Like, I know what the answer is. But we have to be very judicious and making sure we're ruling out other things that it might be. So as a physician, we always do a good history and a physical exam and make sure there's nothing else going on or something else that could be going on that would be tragic if we missed. Like, let's say somebody's having seizures and that's why they're spacing off, and that's not actually inattentive ADHD, but they're having seizures and they need seizure medications. Like that would be something that you wouldn't want to miss. And there's a lot of other things that can kind of
does autism, like do any of the characteristics of autism, how much do those overlap with ADD?
Yeah, so autism, so a lot of kids, you can have ADD and autism at the same time. And I think a lot of autistic kids struggle with ADD, and it's harder to diagnose because because of their social cues are not quite what like a normal kid would be. So they're not, they're like, people with autism can be very interruptive, and so can people with ADD. So that's when it gets kind of, into the gray zone and not so much the black and white. And that's when you would think about referring to like a developmental pediatrician or a psychiatrist, or a different type of specialist to help sort out those types of details. That would be more out of the wheelhouse of your general pediatric doctor.
When you diagnose, then you said you fill out forms and things like that. This isn't like a blood draw type of scenario, though. This isn't like a let's run the numbers to see if you have ADD, right? This is more just behavioral based, right?
Yeah, exactly. So there's certain things that you need for diagnosis, and it's set up in the DSM-5, which is it's basically like your psychiatric type illnesses. It says things that you must have, and then it will give you the subtypes and how to be diagnosed in those different subtypes. I'll just give you like the primary things. So the hyperactivity or impulsivity, it has to be often. It has to occur in more than one setting. So, like school, home, at the store, like it has to occur in more than one space. It has to persist for at least 6 months. And you need to have these things before the age of 12. And then it has to impair your function academically, socially, occupationally. And then it needs to be excessive for the developmental level of the child. I don't know if you've ever watched a 3-year-old run around, but they all look like they have ADHD, which is generally why we won't diagnose somebody with ADHD until they're at least 4. And even then we're very careful because they might just be a rambunctious child. And we don't want to start medications on a kid that might just be normal, because these medications don't come without consequences. Even though they're very good at helping with ADHD, there's other things that come along with taking a medication that can be detrimental to the child's health as well, like losing weight and appetite and having insomnia. There's like a lot of different things that the medications can lead to. So you have to be careful for sure.
You're saying medical speed could be adverse towards the child?
Yeah, I guess that's what I'm saying, Cameron.
Nice.
Because that's essentially what the medication is.
Yeah, it's an amphetamine.
Yeah.
It just isn't released quite as fast.
Doesn't release quite. Releases a little bit slower, but yeah, basically that's what it is. So I mean, and that's another thing I think we could touch on, like, if your kid all of a sudden calms down a little bit after you give them some caffeinated beverage, your kid might have some ADD or something. So
yeah, that's something to think about for sure. If you have a very rambunctious child that you give caffeine to and it calms them down, and then they focus and they clean their room and they do all their homework and you didn't have to remind them once, yeah, that's probably a good sign that you need to go seek out your friendly pediatrician for a diagnosis.
Nice.
But there were a couple things that I wanted to touch on for like pathogenesis. So like
making up words, Johnny.
Yeah, so it is a made-up word, and I just did that to see if you'd catch me. But this is basically the things that like why do people have ADHD? Like, is it genetic? Is it environmental? All these different types of things. So they have done. Have you guys ever heard of a twin study or first-degree relative study?
Yes, I think.
I'm going to go with no, just to.
So basically, if there are twins, let's say they're identical twins, but they were both adopted into different families at birth. Okay. So their environmental everything is completely different than the other. Um, the they can test to see if different diseases have a genetic component. So if twin A gets high blood pressure and twin B gets high blood pressure, and that happens at a very high rate, then we know that high blood pressure is more genetic. So they can do this. They can estimate with like first degree relatives and twin studies and these types of things. And they compiled all these stats together, and they assumed that about 75% of ADHD is from genetic factors that we don't really know exactly what those factors are, but 75% is from your parents. So, and then there's other things too that will
So
can.
wait, you
Oh,
just
sorry.
said Gattaca was right when they did the DNA testing of the kid.
Yeah, that's true. That's a good movie.
It is a good movie. But
Gattaca.
anyway,
Yeah. So the
sorry,
second
that's
thing
my
is
ADD
like,
kicking in.
There it is, shining up, quick.
the second thing after genetic factors is like the neuroanatomy. So the actual structure of the brain is different in somebody that has ADHD, and then catecholamine metabolism. So you've probably heard of like dopamine and epinephrine, and those are different type of catecholamines. They send signals in your brain and throughout the rest of your body, and it appears to play a role through like rat models and things like that. But this hasn't really been studied very much in humans. But it does appear that those things contribute a lot to the ADHD, and then the environmental triggers will be less so. So it's like a very strong genetic predisposition with a very small environmental trigger for those types of things. You know, like for example, if there is some tribal child that all he does is work in a field all day, he's probably never going to be diagnosed with ADHD. You know what I mean? Like he's never in the situation where that would really affect him and the way that he's doing things. So that your environmental influences and the place that you are and the society that you're forced to become a part of play a big role in how detrimental ADHD can be to you. Does that make sense?
Yeah, it does. Maybe you're going to talk about this, but one of the other questions I had is, so does ADHD as you age, I mean, it doesn't go away. Cameron still deals with it, and we talked about, but do the symptoms become less acute? Or is it just they learn to the people that have ADHD just learn to deal with it, and the brain? Do some of those neural pathways get straightened out, I guess? Does it become more along the lines of what you'd see from someone without ADHD?
Yeah, so as your brain develops, the last part of your brain, especially in boys, sorry, men, but girls are more mature than us when they're younger, but we catch up at about the age of 23. So, the frontal part of your brain, which is involved in these complex, thought processes and planning and all these different types of things that are very complicated for your brain to do, it as it develops further, it actually helps the ADD, the ADHD. So kids that are like 6 and 7 that have just outrageous, terrible ADHD, that are on maxed out medications, that can barely function, are losing weight because they're on so many medications. Once they hit puberty, interestingly, generally the dose for the medication that they're on becomes a lot less, because they're able to think more clearly and they're able to do those things, those complex thoughts that they couldn't before. So that seems to help. That's one thing. Another thing that seems to help is that as you grow up with ADHD, and Cameron can probably attest to this, is you start to learn how your brain works, and you learn ways around your ADHD because everyone wants to fit into society. Like that is our goal. We want to be a member of society. And as you learn how your brain works, then you can help your brain to fit nicely into that society so that you don't stick out and you don't feel like you're an outcast or that you're different in some type of way. Have you seen that, Cameron, that you've been able to kind of train your brain in a way?
I would say I've been able to train my brain. I don't think I've ever fit in society. I try really hard, but
It doesn't
there's
help.
just something about me in that I just
Is
never
it
fit
maybe
in.
the height?
Yeah,
Height,
that could be part of it.
personality, I don't know.
Oh man.
It's a
Yes.
running joke now at work that Cameron has all the fun facts. So if you want to hear something random, just ask him and he'll tell you a fun fact of the day.
There you go.
That and
Nice.
I just know a whole bunch of random stuff. So like it'll be
Yeah.
like $10 that Cameron knows what it is, and you tell him da da da, and then I can usually. But
we've had instances of that on the podcast. Actually, I don't remember one of our very early episodes. We discussed should we eat it and how. That was the name of the podcast, I believe. And I said something, and I don't remember what the name of it is. It's eating paper.
it's Pika.
Okay, there it is. I said Pika. Does anyone know what that is? And you said, yeah, that's eating paper. I was like, I don't know who would know that generally.
Johnny would. He's a doctor.
Yeah, I know all about that. Philomania.
Okay, yes, but you're
That's
not
when
a
you eat
doctor.
your hair.
Oh
Yeah,
my.
we actually talked about that in the podcast. But anyway, yeah,
Yes.
let's
Anyway, okay.
actually go back. That I have not gone to medical school, but I did take a lot of medical classes in college. Let's just say that.
There you go. Well, you took a lot of college. Lots of different classes.
You know, some of
Also
us go to
podcast
8 years of college and get a bachelor's degree instead of a doctorate. But you know, whatever.
Each person takes their own path. Okay, a couple questions before we wrap up here. Johnny, so I'm at home. I'm sitting here. I've got a number. Well, I've got a lot of kids, but let's take me out of the picture here. I've got my kid, and I'm thinking this kid can't focus. You've told us the age at which they can be diagnosed, but I guess if I'm a parent at home, I'm trying to calculate what's the likelihood that my kid has. Is it more prevalent in a specific gender? Is it what percentage of kids actually do have it? What are some of the numbers that people can be familiar with as far as that goes?
Yeah, as far as prevalence goes, the one so I'm pretty sure that it's more prevalent in boys, but I also am thinking that is because I know that they more likely will have the hyperactive type and impulsive type. So they'll be like very disruptive and things like that. Whereas the girls that have ADD tend to be more of the inattentive type, to where they're just the sweet girl that daydreams. Like, how can you be mad at her?
Right.
And like Tim was saying, in the classroom, that type of a student isn't going to be the one that gets the attention unless somebody's like, oh yeah, she has ADHD. So I think that has something to do with it. But if you have like a strong family history of ADD or ADHD and you are suspecting that your child might have it, I would really encourage you just to see your pediatrician to get some testing and things. That we give there's different types of tests that you can do for ADHD, and you basically have, remember, it has to be in 2 areas. So you have mom fill out one test, or dad fill out one test, or mom and dad fill out a test, and then you have like a teacher or a couple teachers fill out these questionnaires, and it's pretty obvious, that there are quite a few questions. It takes maybe 15-20 minutes to fill it out. But it becomes pretty obvious when a child has it, when they don't. And then as far as treatment goes, I know we've talked a lot about medications, but treatment can be, therapy and, different techniques to help yourself. And since ADHD is more recognized now, therapists are getting better at helping with thought processes and learning to cope with ADD. But sometimes you can't put a child into therapy if they are not going to be able to focus on the therapy session. So sometimes it is worthwhile to start a child on medication while you start giving them therapy. And it doesn't mean they're going to be on medications forever, but it means that maybe as they learn more about ADD and how to cope with it, they need that extra support to help their brain focus for the time being until later on. And then maybe they could come off of it. A lot of kids that were on medications for ADD as children and tend to a lot of them don't really need it as adults as they get into their careers and they're able to do things. Some do, and some people do get diagnosed with ADD as adults. Generally, these people had ADD as a child that went undiagnosed because they're very gifted people, and they don't have to focus on something for very long to learn it, and they test well and all those things. But then later on in life, they end up, getting into like very difficult college classes, or even like people make it all the way through college and will get diagnosed in graduate school and doctorate school, which is kind of crazy. But there are these really smart people that have never really needed to focus on something for very long. And now that they're having to focus for a long period of time on one thing, they can't do that and they get diagnosed later. But generally, there were the signs earlier on, but it just didn't go diagnosed, or wasn't really a priority to get it diagnosed because they were functioning normally in society
Right.
at that time.
So one question, I guess, one last question. Well, maybe one other. Anyway,
I'm counting.
Yeah, I got a certain number. Otherwise, you're going to start charging me an hourly rate, I think. But
No, I got you on the timer. Don't you worry. This is already
okay.
a level 4. No, I'm just kidding.
We don't have the funds to pay you, Johnny. Sorry. We have made a whopping $20 bill on this podcast so far. So no, it seems like society in general has become less able to focus, right? From be it just the Facebook generation, the always on a screen, jumping from here to there, all those types of things. Are we getting more people with ADD, or does the definition of ADD that you supplied earlier essentially says that it's causing problems in how you're interacting with society? So if society in general is less focused, maybe as a person with ADD, you are just fitting society better?
Yeah, and that's a good thing to think about. And I honestly haven't done too much research in this, but a lot of developmental pediatricians believe that there is a link between excessive screen time as a child and the development of ADD later. So, how do I? If you're letting your kids watch TV, like that's fine. Like that's not going to hurt
Right.
them. But our recommendations as pediatricians are no screen time until the age of 2, and then after the age of 2, 2 hours of screen time max per day. And I'm talking about the kids that are basically just have an iPad in front of them all day, every day. Like these kids are getting so much stimulation that it's going to be really hard for them to focus when it comes to everyday things. And if they have that genetic predisposition to the ADD, and then their brain is being, fired at that type of a rate, and that this is normal to be, going from, just think about like TikTok videos, okay? This is a great example.
Yes.
It's like 15 seconds, and then another video that's 15 seconds, and another video that's 15 seconds. Like that is not the same for your brain as like if you forced a child to sit down and practice the piano for 30 minutes. Like, it is not creating the same type of connections and the same types of things for your child. So screen time can be detrimental. And to be honest, your kids don't need it. And I know as a parent, like, sometimes it's nice to
Right. Sometimes the
turn
parents
it.
need it.
Yeah, sometimes the parents need it. Netflix is a really good babysitter sometimes. So, you just turn on Netflix and you can go do something else and get some stuff done. But that shouldn't be the default.
Right.
If you want your kids to be a really high functioning person in society, and especially if there's that propensity for ADHD, then trying to steer your kids away from screen time and towards something that takes creativity and using those parts of their brain that are actually going to help them develop and become, a higher functioning member of society. I just encourage people to do that. But yeah, I would say screen time and like all this, these flashy, exciting things that are changing all the time. I'm sure it's not helping people that have that propensity to have ADHD stay away from it, if you know what I mean.
Yep.
Hmm.
Do you like TikTok, Cameron?
I do. I do like TikTok.
The movie's a little long for Cameron, but
No, I think all of us can attest to that. I would zone out in a movie and just go really deep into it.
Are the TikToks too long for you, Cameron?
No, TikToks are not too long. TikToks are different. I can literally tell you, it makes my ADD worse. I can tell you that. Literally, it does. Because it's just this.
Like, if you watch it for like 30 minutes, then after that, it's really hard to focus.
Oh, yeah. Well, it's more like I focus on TikTok for like an hour, and I am like, where the heck did this hour go? And then it's really hard to refocus. But
interesting.
It gets really hard. But
we have our N of 1.
So that's really hard. But I'm just like thinking, like, we watched a fair bit of TV as kids, but I also I know that I like to go outside more a lot of the times than watching TV too. Like, I enjoyed playing video games and stuff like that, but I also just loved going outside, playing outside. So
yep,
that probably helped me later on.
Yep.
So.
And I guess one thing to say, and maybe Cameron, you can also say something, just encourage people that are either parents or interacting with someone with ADD or someone that has ADD. It's sometimes it's hard because you don't. If you haven't been diagnosed yet, you don't want to have something wrong with you. You don't want to go on a medication or whatever else. But the reality is, you're just trying to find a way to deal with the situation that you have, right? Be it something that has been environmentally set off, like Johnny said, because you were disposed to it, or if you've just had a childhood where you were just in front of a screen for a long time. You got to find a way forward, and so that's what laymen are really good at, is finding a workable, pragmatic solution, and the doctor can help with that. And like Cameron's attested, that there are things that you can do. So the more that you're able to figure out what situation you're in, as opposed to denial, the better you can kind of find solutions that'll help.
Yeah,
and you see people with ADD in all different types of jobs and things. Like, I know several doctors that have very severe ADD and still have to take medications, otherwise they can't get any of their work done. So just because you have ADD, it doesn't make you less of a person, it doesn't make you less smart or anything like that. It just means that there's barriers to overcome, and everybody has barriers in their life. And this one, I'll be honest, it really sucks, but that barrier is getting easier to overcome with all the therapies and things that we can do to help somebody along.
Yep.
Yeah.
Cameron, any final words of encouragement and or insight into ADD?
No, just kind of, a little bit to kind of go with what Johnny was saying earlier. I don't know if you, just distinctly as a child, I did not like reading at all. Like, I hated reading, probably because it took that focusing that I was not very good at to read. But I enjoyed having books read to me as a child. Like I remember that because our parents would do that growing up, which was great. And now I love audiobooks. I listen to audiobooks constantly. Even while I'm working, I listen to audiobooks. Maybe I shouldn't, but I do.
It's okay. Your manager doesn't listen to this, Cameron. We're good. Oh, wait. Do they?
As far as I know, they don't.
Okay, we're good.
But anyway, but yeah, no, they know I do. Like I don't know
Right.
what I'm doing. I'm just like, oh, I'll listen to that. And like, how do you work and listen to an audiobook? I'm like, well, it's like, listening to music.
Right.
It's harder to listen.
It probably helps you focus because you're giving your brain that stimulation that it needs to stay focused.
Yeah, I mean, it's harder to do work if it's a new book that I haven't listened to, but if it's books that, because I like to re-listen to books that I've enjoyed. If it's something like that, I can just put it on and just listen and just work, and then it's like music, and or I'll be like, oh, that's a really good part, and then listen for a little bit, and then go back to work and kind of put it in my background. So
Great. Okay. Well, so there are strategies and there are things you can do. And I guess at this point, so we're nearing an hour. So if you're still listening, you probably don't have ADD, or you've tuned us out. So,
or you're also listening to an audiobook and this at the same time.
I would also suggest, like Johnny said, be really honest with your doctor what the medication's doing, stuff like that. If it's not helping, maybe you need something else, stuff like that. I know when I was older, after I got put on Adderall, it did weird things to me. So, like, my heart would race super bad. Like, it would hit, and I could literally feel my heart racing. Also, I got really bad depression when I was on Adderall, which was... I don't think it's a common side effect, but it is a side effect. But, there's definitely things you should always be in conversation with your doctor when you're doing that. Or if you have a child, make sure you're in good conversation with your children so you know what they're experiencing so you can make sure that they're okay. I would say that.
Yeah, for sure. There's a lot of options now. So just being honest is the best thing to do so that your doctor can help you with where you're at. Yeah.
Perfect. I think that's a great way to end. So I appreciate the insights from Cameron and Johnny and Tim, and we will be back next podcast. We're going to be resuming our history series here shortly. I think the next podcast will probably be a history podcast. Not a great one for people with ADD potentially, but it is insightful. And those of you that are following that series, I think we've got a number of people, a large listener base that have been enjoying those podcasts. So come and join us back for that. Follow us on Spotify. We have a lot of listeners on Spotify. We have very few on iTunes. I think that's because every time Matt's on, he tries to offend them. Matt's not on right now, so let's just tell your friends that use iTunes that we don't hate them, and we'd love to have them follow our podcast along with all the people on Spotify and Amazon and Google, all those other places. But review us, whatever else, and hopefully if you want us to discuss something, questions for Johnny or Cameron or myself, hit us up on our website. And that's learnfromalayman.podbean.com, and we will be back again next episode. Thanks.
Or Facebook.
Facebook.